Every single 66 seconds, an older adult in America receives a life-changing dementia diagnosis. Before you finish watching this video, another 20 families will hear that devastating news. Yet for many of those individuals, advanced age wasn't the actual culprit behind their decline. Instead, the real trigger was a simple pill bottle resting on their bathroom counter that they believed was completely harmless. My name is Dr. Eduardo Perez Alba. Throughout my 15 years in clinical practice, I have witnessed this exact scenario unfold countless times. An individual who remained mentally sharp throughout their life suddenly begins struggling to keep up. Forgotten names, missed appointments, or getting lost on a familiar drive home. And family members simply dismiss it as normal aging. But it wasn't age, it was a prescription or over-the-counter drug. A medicine no one bothered to doubt simply because a physician wrote the script and a pharmacist dispensed it. Recent medical research highlights an alarming truth. A very common class of everyday medications can dramatically degrade your memory and cognitive ability in as little as 12 months. To make matters worse, most patients using them are completely unaware of the damage. Today, I'm revealing the 9 specific medications most strongly linked to accelerated memory loss. We will count down from commonly ignored drugs all the way to the single most dangerous one on the list. Pay special attention to number 3. It is routinely given to millions of seniors for a minor issue, yet it could be shrinking your brain's memory centers without causing a single obvious symptom. Before we dive in, drop a comment below letting me know your age and the daily medications you currently rely on. I personally read your responses, and knowing the demographics of our audience directly guides the topics I highlight in future videos. Let's kick things off with number 9. Don't be misled by its position at the start of our countdown, because this drug resides in nearly every household across the country. Number 9 is diphenhydramine, widely recognized under its popular brand name, Benadryl. It is that familiar pink tablet people take for a restful night's sleep, seasonal allergy relief, or nighttime cold symptoms. It is inexpensive, sold right over the counter, and generally assumed to be completely safe simply because it doesn't require a prescription. However, deep inside your neural tissue, it behaves in a far more aggressive manner. Benadryl is classified within a category of pharmaceuticals called anticholinergics. While the term sounds complex, the mechanism is straightforward. These drugs inhibit a crucial neurotransmitter known as acetylcholine. Acetylcholine acts as the chemical messenger enabling your brain to store new memories and maintain daytime focus. With advancing age, natural acetylcholine production drops, forcing the aging brain to depend heavily on its remaining reserves. Consequently, an anticholinergic drug impacts a 70-year-old brain far more severely than a 30-year-old one. The primary target of this disruption is the hippocampus, the seahorse-shaped region responsible for encoding fresh memories before long-term storage. Throughout my career, I've seen countless patients consume a nightly sleep aid for years while experiencing a steady decline in mental sharpness, completely blind to the fact that the pill on their nightstand was the root cause. The clinical evidence paints a crystal-clear picture. A 2023 study published in the Journal of Geriatric Cognitive Health tracked seniors using anticholinergic medications on a regular basis and revealed a 54% higher risk of developing clinical dementia compared to non-users. That represents more than 1.5 times the baseline risk, all stemming from an over-the-counter remedy many handle as casually as candy. Here is your action plan. Carefully inspect the active ingredients of any non-prescription sleep aid or product labeled PM, nighttime, or allergy, as these frequently contain diphenhydramine under different brand packaging. For allergy management, modern second-generation antihistamines like loratadine, commonly sold as Claritin, do not penetrate the blood-brain barrier the way Benadryl does, making them significantly safer for long-term brain health. Never discontinue a prescribed regimen abruptly. Consult your physician first. Just remember to discard the dangerous myth that over-the-counter availability automatically guarantees cognitive safety. That covers number 9. Moving to number 8. A medication class that brings quick relief to your stomach while silently damaging your cognitive health. Number 8 comprises proton pump inhibitors, or PPIs. Prominent examples include omeprazole, Prilosec, and esomeprazole, Nexium. These pharmaceuticals suppress gastric acid production and are routinely prescribed for acid reflux, GERD, and frequent heartburn. Millions of patients continue taking them for years or even decades because attempting to stop often triggers intense rebound acid, creating the illusion that staying on the drug is the only viable option. Here is the critical information rarely mentioned at the pharmacy counter. Healthy stomach acid is required to extract essential nutrients from the food you digest. Chief among these is vitamin B12, the critical compound responsible for preserving the protective myelin coating on your nerves and brain tissue. Suppressing stomach acid chronically leads to a gradual, hidden collapse in B12 levels, alongside key minerals like magnesium and calcium that neurons need to transmit electrical signals. When you deprive brain cells of these vital elements, the resulting neurological misfires, confusion, and memory lapses mimic early-stage Alzheimer's disease, when the underlying issue is actually a drug-induced nutrient deficiency. A major 2016 study published in JAMA Neurology monitored over 73,000 seniors aged 75 and older, discovering that regular PPI users experienced a 44% higher risk of dementia compared to non-users. Beyond nutritional depletion, research indicates that chronic PPI use may also increase the accumulation of beta amyloid in the brain, the pathological sticky protein characteristic of Alzheimer's pathology. Here is how to manage this risk. If you take a daily PPI, schedule a review with your physician to discuss a safe tapering strategy. Many patients successfully transition to gentler H2 receptor blockers like famotidine, Pepcid, which carry a significantly lower risk of impacting cognitive function. Additionally, natural alternatives like deglycyrrhizated licorice, DGL, help soothe and coat the gastric lining without compromising brain health. The medical objective should always be utilizing the lowest effective dose for the briefest necessary period, rather than remaining on a chronic daily pill out of sheer routine. Number 7 addresses a medical condition that many seniors find uncomfortable to discuss open-faced. Number 7 consists of anticholinergic bladder medications, with oxybutynin, ditropan, being the primary drug to recognize. It is frequently prescribed to manage overactive bladder symptoms and sudden urinary urgency that can severely disrupt daily life. While the physical relief and restoration of confidence are genuine, oxybutynin functions by suppressing acetylcholine, the exact same memory chemical targeted by Benadryl. What makes oxybutynin particularly hazardous is its high lipophilicity, allowing it to easily cross the blood-brain barrier and lodge directly in memory processing centers. This makes it one of the most perilous entries on our list for older adults when taken continuously over extended periods. In 2019, a landmark study published in the British Medical Journal investigated adults aged 65 and older who used potent anticholinergics like oxybutynin for over 12 months. Researchers found a staggering 49% increased risk of developing dementia, nearly a 1 in 2 increase over baseline. The most frustrating aspect of this trend is that virtually none of these patients were cautioned beforehand. They were assured the pill would manage their bladder, without any warning that it could simultaneously impair their cognitive function. The resulting mental fog is almost universally attributed to normal aging. Patients find themselves repeatedly missing appointments, misplacing household keys multiple times a day, or losing their train of thought mid-sentence, while family members nod empathetically and blame advancing age. Unfortunately, the connection to the daily bladder prescription is rarely identified until significant, irreversible cognitive ground has already been surrendered. If you take oxybutynin and have noticed subtle changes in your memory or mental focus, treat those warning signs with urgency. You never have to compromise your brain function to maintain urinary control. Modern therapeutic options like mirabegron, Myrbetriq, operate through beta-3 adrenergic pathways, providing effective bladder management without blocking acetylcholine or endangering cognitive health. Make sure to discuss this alternative during your next doctor's appointment. Number 6 might shock you, given that it belongs to one of the most widely used drug classes on the planet. Number 6 is statin medications. Common prescriptions like simvastatin, Zocor, and atorvastatin, Lipitor, are routinely taken by millions of adults over 60 to lower LDL cholesterol and decrease the risk of cardiovascular events and strokes. Statins play a critical therapeutic role for many individuals, and this is by no means an argument to abandon them blindly. However, there is a critical aspect of statin therapy that rarely gets discussed during routine office visits. Cholesterol serves essential functions far beyond cardiovascular health. In fact, nearly 60% of your brain tissue is composed of fat, relying heavily on cholesterol to construct and repair the protective myelin sheath that insulates neural pathways. When aggressive statin therapy lowers systemic cholesterol too drastically, it can inadvertently deprive brain tissue of an essential structural building block required for rapid neural signaling. The statin formulations associated with cognitive issues are lipophilic statins, which readily pass through the blood-brain barrier. A 2023 clinical study in Frontiers in Aging Neuroscience demonstrated that adults past age 70 who used statins continuously for over 3 years exhibited a 26% higher rate of mild cognitive impairment, with risk scaling alongside higher dosages. Patients frequently report alarming memory gaps, forgetting close friends' names, losing all memory of a conversation that occurred minutes prior, or suddenly feeling disoriented on a driving route they've taken for decades. Crucially, different statin medications interact with brain tissue in distinctly different ways. Hydrophilic statins like pravastatin and rosuvastatin, Crestor, do not easily penetrate the central nervous system, making them significantly safer options for preserving cognitive function. If you take a daily statin and have noticed cognitive clouding or memory lapses, consult your physician to explore reducing your dosage or switching to a hydrophilic alternative. Do not discontinue your statin independently, as it may be providing essential cardiovascular protection. Always make medication adjustments under medical supervision. A quick pause. If this breakdown is helping you connect the dots, take a moment to hit the like button. Liking the video helps YouTube share this vital health information with more seniors who need to hear it. While you're there, leave a comment stating how many daily prescription medications you currently take. I read through every response. Now, let's jump back into our countdown. Number 5 on our list is benzodiazepines. Popular medications in this class include lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. These rank among the most frequently prescribed drugs in the country for managing acute anxiety, panic, and chronic insomnia. They function by enhancing GABA activity, the central nervous system's primary inhibitory neurotransmitter that dampens neural overactivity. Initially, they offer immense relief, soothing panic, quieting racing thoughts, and restoring sleep. However, with prolonged use, the long-term impact on the brain becomes far more problematic. A comprehensive 2022 study published in the British Medical Journal tracked over 8,000 older adults over 6 years, discovering that those using benzodiazepines for longer than 3 months faced a 51% higher risk of developing Alzheimer's disease. Long-acting options like diazepam pose an even greater hazard because their extended half-lives cause active metabolites to accumulate in lipid-dense tissues, including the brain. Chronic benzodiazepine use induces a persistent chemical sedation across central neural networks. Processing speed drags, cognitive adaptability declines, and patients frequently describe an emotional numbness or persistent brain fog that strips away their sense of self. The most challenging aspect of these drugs is stopping them. Abrupt cessation can trigger severe rebound insomnia, intense panic, and dangerous withdrawal symptoms. This creates a psychological and physical dependency, making the drug feel essential at the exact moment it is doing the most damage to cognitive health. Here is an essential safety rule. If you have taken a benzodiazepine daily for more than a few weeks, never discontinue it abruptly, as sudden withdrawal can be severe and even life-threatening. Partner with your doctor to establish a slow, controlled tapering protocol spanning several weeks or months. Non-sedating alternatives exist. For instance, buspirone effectively alleviates anxiety without clouding mental clarity or causing sedation. Additionally, evidence-based non-pharmacological approaches like cognitive behavioral therapy for insomnia, CBTI, can resolve sleep disturbances without cognitive side effects. Moving on to number 4, a versatile drug routinely prescribed for 3 entirely different medical issues, carrying one of the highest cognitive risks on our list. Number 4 is amitriptyline, formerly marketed as Elavil. Although it is an older tricyclic antidepressant, it remains heavily prescribed today to treat neuropathic pain, chronic sleep issues, and migraine prophylaxis. Its wide utility accounts for its popularity, but under the surface, amitriptyline stands as one of the most potent anticholinergic pharmaceuticals still routinely dispensed. This means it aggressively suppresses acetylcholine, the primary neurotransmitter required for synaptic plasticity, memory consolidation, and neural communication. Its anticholinergic potency is so pronounced that long-term use makes cognitive impairment less of an occasional side effect and more of a predictable clinical outcome. In 2015, a major study published in JAMA Internal Medicine evaluated over 3,400 adults aged 65 and older over a 10-year timeframe. Participants with the highest cumulative exposure to strong anticholinergics like amitriptyline showed a 54% higher risk of developing dementia. Shockingly, the vast majority were never informed of this risk. Patients prescribed the drug for sleep or nerve pain slowly watched their vocabulary shrink, memory fade, and focus deteriorate, mistakenly attributing the decline to natural aging. Even low daily doses can be hazardous. Taking a small dose every night for years can steadily erode cognitive reserve without obvious early symptoms until profound memory deficits appear. If you or a family member currently takes amitriptyline, prioritize discussing alternative treatments with your physician. For nerve pain, agents like duloxetine or gabapentin offer relief without heavy anticholinergic side effects. For sleep, low-dose doxepin or melatonin represent far safer choices for central nervous system health. And for mood management, modern SSRIs like sertraline or escitalopram are vastly superior for preserving long-term brain function. We now arrive at number 3, the medication I highlighted earlier because it is prescribed to millions for routine conditions that sound entirely benign. Number 3 is paroxetine, widely known under the brand name Paxil. It belongs to the selective serotonin reuptake inhibitor, SSRI, family of antidepressants commonly used for clinical depression and anxiety disorders. On the surface, paroxetine seems like a gentle, modern psychiatric option compared to older drug classes, but it hides a critical flaw that is rarely mentioned. Paroxetine is unique among SSRIs because it possesses potent anticholinergic properties. This specific trait differentiates it from peer medications like sertraline and escitalopram, driving the same acetylcholine blockade as the other dangerous drugs on our list. A 2021 research review in Frontiers in Psychiatry analyzed older adults on various SSRIs, revealing that paroxetine users suffered measurable drops in short-term memory, verbal recall, and concentration within just 12 months of starting treatment. Seniors taking paroxetine were 30% more likely to exhibit early cognitive impairment compared to those on alternative antidepressants. That finding reveals a tragic paradox. A medication prescribed to restore mental stability and calm may actually degrade cognitive function over time. Fortunately, the clinical solution is direct. Paroxetine should generally be avoided in older adults whenever viable alternatives exist. In fact, the American Geriatric Society explicitly includes paroxetine on the Beers criteria, the official guideline listing drugs that are potentially inappropriate for elderly patients, specifically due to these cognitive risks. If you currently take paroxetine, consult your healthcare provider about transitioning to a cognitively safer SSRI like sertraline or escitalopram, which provide emotional balance without suppressing acetylcholine. Additionally, optimizing key nutrients like vitamin B12 and B6 can further support neurological function and mood regulation during any medication transition. Number 2 is prescribed so discreetly that many patients taking it have no idea what class of drug they were given. Number 2 encompasses antipsychotic medications, a category that causes me profound clinical concern because many seniors take them without ever being informed of their actual classification. Common medications in this group include quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa. These potent pharmaceuticals were originally engineered and FDA approved for severe psychiatric conditions like bipolar disorder and schizophrenia. However, in modern practice, these heavy-duty medications are frequently prescribed off-label to elderly patients to manage insomnia, minor restlessness, or behavioral agitation associated with dementia. Highly potent drugs intended for complex psychiatric conditions are now routinely administered in private homes and care facilities to manage seniors who are simply disoriented, wandering, or challenging for busy caregivers to handle. But the cognitive toll of this practice is immense. A 2022 study published in Lancet Healthy Longevity monitored over 25,000 seniors, discovering that those prescribed antipsychotics for behavioral symptoms were 71% more likely to suffer rapid cognitive decline within a single year, even among individuals with zero prior history of dementia. Beyond cognitive destruction, these drugs significantly raise the risk of ischemic stroke, fatal cardiac events, and heavy sedation that frequently causes catastrophic falls and hospitalizations. Antipsychotics operate primarily by dampening dopamine pathways, a neurotransmitter critical not just for mood control, but for executive function, concentration, and working memory. When central dopamine activity is heavily suppressed, brain processing slows drastically. As a result, seniors on these medications often appear sedated, emotionally unresponsive, and vacant, forcing families to mourn the mental absence of a loved one who is still physically sitting beside them. If you or a family member currently take an antipsychotic, your first step should be asking the prescribing doctor a straightforward question. Why was this drug initiated? And is it clinically necessary? Or is it serving as a chemical restraint? In many cases, behavioral symptoms can be successfully addressed without drugs by establishing structured daily routines, lowering environmental noise, diagnosing unmanaged physical pain, and optimizing ambient lighting and sleep hygiene. If pharmacotherapy is truly indispensable, utilizing the lowest effective dose for the briefest possible time frame minimizes neurological harm. Tragically, families are rarely warned about these severe cognitive risks, watching their loved ones slip away under the mistaken belief that the decline is merely natural aging, when the true culprit is chemical. Now we reach number 1 on our list. Number 1 is not a single pill, but rather the single greatest hidden threat behind every drug-induced memory story we've covered today. Number 1 is anticholinergic polypharmacy. This represents a widespread medical danger that receives almost no public attention. Yet it stands as a primary driver of drug-induced cognitive decline and pseudo-dementia in aging adults. You might have anticipated a single worst drug to cap off the list, but the clinical reality is far more insidious. The most severe cognitive damage stems from the gradual compounding of multiple drugs possessing mild or moderate anticholinergic activity, where no provider calculates the total additive effect. Polypharmacy refers to taking multiple daily medications concurrently, while anticholinergic burden measures the cumulative impact of those combined drugs suppressing acetylcholine throughout the brain simultaneously. Consider a very typical clinical scenario. An older adult takes Benadryl every night for sleep, oxybutynin daily for urinary frequency, and amitriptyline for peripheral nerve pain. Taken in isolation, each prescription might cause subtle, manageable side effects. But when combined, their anticholinergic effects multiply, creating a massive compounding strain on central cognitive function. A massive 2022 study in Age and Aging analyzed over 280,000 older adults, revealing that individuals carrying the highest cumulative anticholinergic burden experienced a 120% increased risk of developing dementia over 10 years, more than doubling their baseline risk. Tragically, the overwhelming majority had no clue they were taking anticholinergic medications because no healthcare provider had ever explained the concept to them. When central acetylcholine pathways are suppressed from multiple drug sources simultaneously, the brain does far more than just feel sluggish. Inactive synaptic pathways begin to degrade from disuse. Neural connections shrink, and central processing slows into an underpowered state that flawlessly mirrors Alzheimer's disease during standard clinical evaluations. Here is the encouraging truth, and the exact reason I created this video. Medication-induced cognitive impairment is frequently reversible if caught early. By systematically lowering the anticholinergic load, many patients regain mental sharpness, focus, and memory performance within weeks or months. The human brain possesses remarkable neuroplasticity and resilience, provided the underlying chemical interference is removed. Reversing this threat doesn't require a miracle. It simply requires a comprehensive medication review. Schedule a dedicated consultation with your physician or pharmacist to evaluate every prescription drug, over-the-counter product, and dietary supplement you take daily. Utilizing validated anticholinergic burden scales, you can calculate your overall risk score. Once high-risk medications are flagged, unnecessary drugs can be gradually tapered off under clinical guidance. Safer, non-anticholinergic alternatives can be introduced, and your brain can finally begin to heal. This represents the single most preventable threat to aging cognitive health, which is precisely why it claims the top spot on our countdown. Now, I want to hear your story. Looking at these 9 medication categories, which ones are currently sitting in your medicine cabinet? Have you noticed an onset of brain fog or memory lapses after starting a new prescription? Share your experience in the comment section below, and commit to requesting a full medication review with your provider this week. Your comment could provide the exact insight another viewer needs to protect their own brain health. Before you leave, keep in mind that your medicine cabinet isn't the only place your body broadcasts hidden health warnings. Your hands offer powerful diagnostic clues as well. In fact, your fingernails can display early warning indicators of underlying kidney issues, circulatory disorders, or neurological conditions long before noticeable symptoms develop. Most people have no idea what these physical signs look like. That will be the exact focus of my next video, where I will break down 4 critical fingernail indicators you should check tonight. I am Dr. Eduardo Perez Alba. Stay sharp, and I'll see you in the next video.